arms and I'm gonna cross them across her chest. I'm gonna assume that she is dependent and she's not gonna help me in any way, okay? The second thing that I'm gonna do is I'm gonna take the off leg and I'm gonna cross it over the ankle, okay? Now your key points of control whenever you're handling a patient and you're rolling them are gonna be shoulders and hips, okay? Because that's most of the body, the big part of the body, and the rest of it is gonna follow. So I'll just take her here and I'll roll her towards me. And then they push them to the side. Pushing is always harder than pulling. You have less control. So I like to do it this way. Plus, if I'm by myself, the bed rails are up on that side. I lower the bed rail on this side and the patient feels safer. They don't feel like they're gonna fall off the bed. The way that the nurses like to do it is to bend one knee if it's not contraindicated. And that gives you a little bit more leverage here, and you can drop that knee and she'll come right over. When you wake up in the morning, how do you get out of bed? If I said, get up and sit on the side of the bed, show me what you would do, okay? All right, and she's independent with that, but it takes a lot of coordinated muscle movements and kind of stuff. She sat up and she spun around, okay? And we don't want our patients doing that. Lay back down, okay? The reason being is if I was sitting her up over the side of the bed, the way we did it in physical therapy is we would bend both knees if you could do that, okay? And I would roll her onto her side, okay? And if I wanted to sit her up over the side of the bed, I'd scoop her here, bring her legs off and sit her up this way, okay? And then I'd stay with her. Get down and scoop down. Hospital beds are notorious that when you walk into the room, this is where you're gonna find the patient, down here. Because they're made out of plastic, okay? And the patient puts their head up and they slide down. And then when they go to try to push themselves up, they bend their knees, okay? And they start doing this kind of stuff. And we talked about the decubi on the sacrum. Another bony area is the...
That's ulceration. Is what he's
Right.
talking about. We talked about ulcers.
Yeah. Is the back of the heels, and you go to take a patient's socks off, and the back here, this pad on the bottom of the calcaneus gets all mushy and stuff like that, and it's breaking down from the inside, and then you end up with a hole in the bottom of the foot about like this, because hospital sheets are made out of sandpaper, and if she did this all day, she'd start breaking down. Okay, so we have to move her up in bed. All right. There's a couple ways to do that. The easiest way is if the patient can do it by themselves. And what I want you to do now is I want you to bend both legs, okay? And I want you to put your hands down here, okay? And you're gonna use your hands and you're gonna use your feet to move up in bed. When I say 3, 1, 2, 3, push, good. And I help her up. All I'm doing is unloading a little bit, okay? Scoot down again, okay? That is a assisted up in bed, okay? The second way is unassisted, where the patient's not doing anything. All right, so, no, stay here, okay? Normally when you make a hospital bed, there's gonna be a draw sheet on it. Any STNAs in this class?
No.
Okay, a draw sheet is like a half a sheet that goes under the patient here, okay? And you can
Make a
use
sausage
it
like this.
Good. Okay, and keep your hands like that. Now, one foot facing that way and look towards that wall, okay? And instead of trying to lift with your arms and do this, okay, all I want you to do is unload her a little bit and shift your body weight up this way. When I say 3, ready? 1, 2, 3, and we move her up in bed, okay? Now, if we didn't have to take that first skill, rolling a patient in bed, okay?
Go ahead, help Carl.
Are you saying prayers? Okay.
Carl, you really want to help him.
And I'm gonna roll her here and you're gonna stuff. And don't short sheet me, okay? And we want this
Can you guys see what they're doing over on this side? Come on over.
under shoulders, under hips, okay? I'm gonna roll her back, you roll her towards you. Cross her leg, that's it. Okay, now we have a draw sheet, okay? And we're gonna get that sausage thing going on. Okay? When I say 3, we're gonna shift our weight up that way. Ready? 1, 2, 3. Good. Okay. It's the easiest way to do this is with 2 people. Okay? And you're gonna take that first rolling log roll, and you're gonna log roll the patient towards you. Okay? Then you're gonna take this and you're gonna put it where it needs to be.
So kind of
And hold it
really
there.
middle, put it in the
Two
middle,
hands.
because when you roll her back, if it's off center, they're not
You're
going to
gonna
be
have
very
to
happy with
adjust.
you, and they're
Yeah.
going to make you roll them
You
back.
make a mistake with a bedpan and you're making an occupied bed, okay? Because they're gonna soil the bed. And then I'm gonna roll her back on this, okay? Now, best case scenario is if there was no contraindication. This is your job. Put that over there. Good, okay? And I'm gonna roll her off of this pan. Your job is to get under there and stabilize that so that the pan doesn't come with her. Because if it does, we're cleaning up a bed. Okay, so 2 hands, you ready? Okay, I'm gonna roll her off. Cover it up with the chucks. Okay, blue side up, just like laying turf. That's good. Okay. Remember when we had the patient moving up in bed? Okay, and I want you to bend both knees for me and lift your butt up. Okay, that's called a bridge. Okay, and down. That particular movement right there is a movement that every patient in the world, even if they're a little bit weak or had a stroke or something like that, it's one of the first things that they can do because we're using a lot of the large gluteal, hamstring, leg muscles in order to get up. She could even do this, bring this leg and point it straight up, lift your butt up, okay? One leg, okay? So patients learn that really fast. Once they can do that, it makes it so much easier to put them on a bedpan because I can say, okay, do a bridge, okay, and I'll put this where it needs to be, good, okay, and then you can stay like that, and I would bring her head up, okay, leave the room, same blah, 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 and when she comes off of it, same thing, lift, okay, cover, or another sheet, or something like that to keep her warm while we're doing this, okay. So that's going to give her modesty. So what I want you to do is I want you to hold on to this top thing that we just put on, and we're going to strip the one that's underneath her and take it off. Okay. Now this could have been either the bedspread and the top sheet or whatever linens are on top of her like that. Okay, and we're going to put that aside. All right. The next thing that we're going to do. Oh, we use the same linens over and over again. Is that what we're doing?
Yeah.
Okay. All right, here's what we'll use that for a bottom sheet, okay? Now the next thing that I'm gonna do is I'm gonna roll her towards me, okay? So I'm gonna cross her opposite leg, and when you do this, the tendency is when you roll somebody, you get them all cocooned up in these things, so you don't wanna get them all rolled up in the sheet that you're using at the top, so just kind of be careful and get that out of the way. All right, now what you're going to do is take all of that linen here and tuck it underneath her, okay? Shove, 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 shove. Good, okay? Now she just handled dirty linens and she's gonna go get the clean linen now, okay? So she would take off a pair of gloves and go get that, and we're gonna use that as the bottom, just for
So pretend that's a
demonstration.
fitted sheet,
Just for
and yeah.
demonstration. And you're gonna put that underneath her and give me half of it, and like you're making a bed on that side of the bed, okay? And I'll help you up here.
So you got, again, 2 different
Straighten
things
that out a little
shoved
bit down
underneath
there.
her.
Good, okay. Now, you're gonna take this and you're gonna roll, I'm gonna roll her on her back and you're gonna roll her towards you. I'm gonna strip this dirty linen, put it in the linen basket, take off my one set of gloves, throw them away, and then I'm gonna make my side of the
With her
bed.
nice clean bed, nice clean sheets. It would be fitted, you would tuck it under, so this would be the fitted sheet.
Good. And roll her back, okay? 2 hands. And grab the back of this, okay? When I say 3, you're gonna do 90% of the work. You're gonna get
All
his
right,
butt
he's
out
younger.
of that chair.
He
and
can
you're
do
gonna
it.
Swing it over there, okay? Ready? Are you ready? 1, 2, 3. Armpits. Easy, right? Grab his wrist. Tyler, you're gonna stand on his side over here and scoop his legs with both hands. Good, good. And when I say 3, we're gonna get him in bed. Ready? 1, 2, 3, up in bed. Boom.
CPR.
As we were doing CPR, the hospital caught on fire.
Gosh, this sounds like a disaster drill. I love this.
Now we got to get him back in the chair and down the hall to a safe area. Okay, so we're going to do the same thing. Okay, I got one leg up here, just to stabilize a little bit. On my 3, we're gonna get him in the chair. You ready? 1, 2, 3, boom, boom, okay?
Run.